Usually, if we're talking from the onset of admitting a resident, we would carry out a pre-admission, which basically focuses on looking at the resident's needs, what their likes and dislikes are, getting to know a little bit about the resident, and then we will go into medical history.
We would do what I would imagine most nurses do within an ward setting. We do things like wound care, we do things like medication administration, vital signs. We look after residents day to day like we would on a ward. We work closely with a lot of the community therapies team, so it's really beneficial for us because we can incorporate a lot what we learn from the community therapies in their day-to-day care.
It's their home. I think hospital's hospital, and I think there's a real difference as opposed to within a care home setting. They've all got the rooms which are all personalised for themselves. The families are in visiting where applicable. But I do think it's a more relaxed atmosphere as well. We have regular staff, which I know they would have in hospital, but I think there's a larger work task force than you would find within a care home setting.
It's a lot more person-centred, so we have a lot of time in comparison to working on a ward where it's a bit more high-paced, fast-paced, where we can get to know our residents, we can get to know what they like, what they dislike, their preferences, and we can incorporate that in terms of fulfilling our clinical duties. So making it a bit more, like I say, person-centred and a bit more tailored specifically to them, rather than just being what you would generically perform on any resident or any individual. It's about them.
And I think sometimes hospital, it definitely has its purposes and there is a need for people to attend hospital, absolutely, but I think social care it also has to play a factor in trying to prevent that where possible. If residents can be treated within the home, then we need to really look at focusing on allowing that to happen with the families, and because it's like their home environment, it's somewhere they feel safe.